This is the World Health Summit 2024. Building trust is the key to global health. People will only take advice from doctors and healthcare authorities if they trust them, like when facing global threats posed by novel viruses. But a lot of trust has been lost. mRNA vaccines saved millions of lives during the COVID-19 pandemic. But poorer countries often had no access to those vaccines. And not every protective measure proved justified all the time. But trust must grow back if we acknowledge that truths might not be absolute, but also continue to act according to the best current knowledge based on science and objective evidence. Artificial intelligence is driving a revolution in medicine. It's helping us create more precise diagnostics and personalized therapies while streamlining processes. But who is supervising and controlling AI development? Every year, infections with multi-resistant pathogens cause hundreds of thousands of deaths in Europe alone. Now all 53 member states in the WHO European region are implementing a common strategy for coping with antimicrobial resistance. Measures span a wide spectrum, from improving hygiene to developing new antibiotics. And in the global south, the escalating climate crisis is making more and more people sick there, making the development of affordable but well-functioning healthcare systems even more pressing. And experience has often shown that when women are put in charge, trust in systems rises. We could rebuild even more trust by ensuring greater health equity. For that, we need reliable investment in global health. The World Health Organization has launched its first investment round, featured at this year's World Health Summit. In the next 4 years, more predictable and flexible financing should enable WHO to save 40 million lives. The World Health Summit is a trust summit. We bring together stakeholders from all over the world to find innovative solutions for better health and well-being for all. Because we need to team up, building trust for a healthier world. The World Health Summit 2024 in Berlin.
Dear Global Health community, we are extremely proud that you gathered again here in Berlin to foster global health, and you will see a number of events which are really worthwhile being here. The most important of those events will be tomorrow when we foster the development of the World Health Organization for the future. But now we have today a more relaxed evening, and between you and the reception is only a relatively short show. I hope you will like it and be uplifted to work very hard over the next days. And I can introduce my co-chair, Beate Kampmann, who is leading the Global Health Center of the Charité, and I hand over to Beate.
All right. Well, thank you, Professor Pries, and welcome to all of you to Berlin. I can't believe to see a hall as full as this on the first night. It's just fantastic. Everybody has a drink, everybody has a friend. What can go wrong? Okay. Right. So I thank the organizers for entrusting me to help opening this wonderful evening in which we are going to reflect a little bit on the theme of building trust for a healthier world. And I guess it has two elements, building and trust. And people say charity begins at home, but actually I think trust also begins at home. And I want just to give you 3 very short examples of how I think at home and here in Berlin we've managed to build a little bit of trust amongst our communities as well. So I have the privilege of leading the Center for Global Health here in Berlin, and we have managed to establish relationships across universities in this city, which was, as you know, at some point a divided city with a fairly divided culture, and trust in global health has somewhat brought us together. And we've managed to establish a relationship between the universities that has also resulted in making global health a challenge for all of the universities in a very specific way of bringing global health research as an academic specialty also to Berlin and to Germany, where it's very much needed still. And another example is that we have just opened a PhD program for global health here between all of those universities, and we've managed to have people from 12 countries in our first year, and I'm really pleased that we've managed to, open the program. So this is certainly a topic that is very dear to our heart also here in Berlin, and we're really, really pleased to see all of you here. And I guess, if we weren't believing in a healthier future, we wouldn't be standing in this room. And I really hope that you're all having a wonderful time and that you can build trust, not just with the people who've come here tonight, but also with people that might be standing next to you whom you have never actually talked. Because trust also means that we have to go out of the little echo chambers in which we are, and this is a wonderful opportunity to do so. And again, a very warm welcome to Berlin, and Axel, the next spot.
Yeah, thank you very much. We wish you all the best for your center and especially for the people coming to the center and spreading the news in the world. And now we go to the world by inviting the Director General of the World Health Organization to the stage. My dear friend Tedros.
Thank you. Thank you so much. Vielen Dank.
It's really a pleasure. The floor is yours.
Thank you. Vielen Dank. Professor Axel Pries, Professor Beate Kampmann, dear colleagues and friends, Guten Abend. As always, I'm delighted to be here. As a founding member of the organizing committee for the first World Health Summit, this I think is in 2009, and now as a patron, it gives me great satisfaction to see how this event has grown. And I'm very proud that in a few moments, WHO and the World Health Summit will sign a new memorandum of understanding to strengthen our partnership even more. Thank you, Axel, and thank you, Beate, for your leadership, partnership, and support. And I look forward to working with you even more closely in the years ahead. Strong partnerships, like strong relationships, are built on trust. Trust has always been the foundation of medicine and public health. Trust itself does not make people healthy, but no one can be healthy without trust. People won't use a medicine they don't trust, or see a health worker they don't trust, or follow advice they don't trust. And when trust breaks down, the consequences can be deadly. During the Ebola outbreak in the Democratic Republic of the Congo, from 2018 to 2020, transmission was being fueled by certain burial customs that involved touching and kissing the deceased. Initially, health workers responded by removing dead bodies from families. But that created significant community resistance and loss of trust. Through careful engagement with civil society and communities, we were able to design burial practices that were both safe and dignified and acceptable to the communities. In short, we built trust. This was a key step in helping to bring the outbreak under control. Trust can be broken easily and for many reasons. Sometimes it's because the care people receive is unsafe. Sometimes it's because care is unaffordable or inaccessible. Sometimes it's because people are excluded from social participation or social protection. And sometimes it's because people receive the wrong information. Internet and social media platforms have given people unprecedented access to health information. But they have also turbocharged the spread of mis- and disinformation, which has contributed to mistrust in vaccines and other health interventions, fueled stigma and discrimination, and even led to violence against health workers and marginalized groups. During the COVID-19 pandemic, falsehoods about masks, vaccines, and lockdowns spread as fast as the virus itself and were almost as deadly. Just as mis- and disinformation undermined the response to the pandemic itself, so it continues to undermine negotiations on the WHO pandemic agreement. Media, celebrities, social media influencers, and politicians have spread false claims that the agreement will cede national sovereignty to WHO and give it the power to impose lockdowns or vaccine mandates on countries. As you know, these claims are, of course, entirely false. Sovereign governments are negotiating the agreement, and sovereign governments will implement it in accordance with their own national laws. It's easy to blame, dismiss, ridicule, or insult those who believe or spread mis- or disinformation. To be sure, governments and internet and social media companies have a responsibility to prevent the spread of harmful lies and promote access to accurate health information. WHO is working with a range of partners, companies, and researchers, and partners to understand how misinformation and disinformation spreads, who is targeted, how they're influenced, and what we can do to counter this problem. But we must also make sure that when we seek the trust of others, we are ourselves trustworthy. We cannot assume or expect trust. We must earn it. That begins with listening to the people we serve, to understand their needs and preferences, and the reasons they believe mis- and disinformation. It means designing and delivering health services that are safe, accessible, affordable, and people-centered. It means providing and promoting health information that is accurate and culturally sensitive. And it means delivering results. This applies to all of us: governments, health providers, researchers, funders, civil society, and WHO. One way WHO is doing this is by actively listening to young people and engaging them in solutions. This is why we established the WHO Youth Council, many of their members who are here today. I would like to thank the WHO Youth Council for drafting the first youth declaration on creating healthy societies, which will be launched at the World Health Summit tomorrow. Everything we do depends on the trust of the communities we serve, the partners with whom we work, and the member states who set the global health agenda and entrust us with the resources to deliver it. And this year's World Health Assembly, member states adopted a new and ambitious strategy to save 40 million lives over the next 4 years, the 14th General Program of Work. Delivering that strategy requires a strong and sustainably financed WHO, which is why we have launched the first WHO investment round to mobilize upfront the predictable funding we need to do our work over the next 4 years. I thank His Excellency Chancellor Scholz, the government of Germany, and the World Health Summit for offering to host a pledging event for the investment round to be held in this room at 6 p.m. tomorrow. We know that we're making this ask at a time of competing priorities and limited resources. But as the COVID-19 pandemic demonstrated, when health is at risk, everything is at risk. Investments in WHO are therefore investments not only in healthier populations, but also in more equitable, more stable, and more secure societies and economies. They are investments in the vision countries had when they established WHO in 1948, the highest attainable standard of health for all people as a fundamental right. As I always like to say, Gesundheit ist ein Menschenrecht. My German is improving. Gesundheit ist ein Menschenrecht. Then finally, equally like trust, peace is important. I just want to say a few words about peace. I hope the next year's theme will be peace. I just came back from a visit to Sudan and Chad. Sudan is in a serious problem. Half of its population needs aid. Quarter of its population is displaced. The horror we heard from mothers who fled to Chad is heartbreaking. Many of them told us that their homes were burned, their crops were destroyed, and their cattle stolen. Out of the 640,000 who fled to Chad, the Sudanese, 94% are women and children. And as always, the victims of war are women and children. And then you know what's going on in Gaza. More than 60% of the casualties are women and children. That alone should have been enough to stop the war. And the war is escalating into Lebanon. And you know the situation in Ukraine. The reason I wanted to end my speech with this is the best medicine is peace. And we cannot talk about health alone. There is no health without peace, and there is no peace without health. As you may know, I said it in many forums, I am a war child. I know war. The only thing I witnessed is destruction. Even at this age, I can feel how it feels. I know its smell. I know it sounds, what it sounds when it's war. I know the bad images. As a child, I have seen head blown up when I was 7 or 8. Except distraction, war benefits nothing. That's why we call upon all warring parties to come back to their senses and to resolve their problems through political solutions. Because as I said earlier, peace is the best medicine. Of course, humanitarians, WHO, we're supporting people in Sudan, in Gaza, in Lebanon, in Ukraine. But you treat people today, then maybe they survive a few days, but then they could be killed because of shelling tomorrow or after tomorrow. That's why we say the best medicine is peace, and I hope we will mobilize around this to advocate for peace. Our world needs peace more than ever before. So thank you so much, and peace to our world, and vielen Dank. Thank you.
Thank you very much, Tedros. Your words need no explanation. They are just true. But now we have to do a little bit of work, and peace builds quite often on friendship, and friendship builds quite often on cooperation. And here we have a cooperation document to sign. And I have the pen of signage to give to you.
Okay.
And there must be a page where we all sign. So
Okay.
this is for you.
So you want to sign first?
Here you go. Okay.
Thank you.
And my dear friend Tedros, I have 2 more gifts for you. I was given this from Jamaica from a dear colleague, and I know that you are a friend of hot sauces.
Okay.
So this is a gift. I don't know whether you will be able to take it home in the plane, but please try.
Thank you, thank you. I think it's the right gift because from childhood in Ethiopia, you're sensitized to hot, spicy. Although I cannot claim that Ethiopian food is the hottest because I thought the Indian was actually more.
We will have time to talk about that.
And Mexican.
And the second gift is to ask the representatives of your youth council for a final photo to the stage. Please come up.
Thank you.
Okay. It's difficult to top that, or maybe impossible to do that. But the World Health Summit is also built on an international network of friendship and cooperation, which is named the World Health Summit Academic Alliance. And we will... Beate, where are you lost?
Yeah, exactly. Yeah, no, that's great.
So we have a very strong academic backbone in the entire world, and we will today... Beate, don't leave me alone.
I don't. It's okay.
We need friendship and partnership, and this is the best way to go. So the next one will be to have a video which shows you a change in the representation of the World Health Summit and its international network. Please, video start. Okay, now you have seen a few glimpses of the Alliance, and I want to invite the two presidents, the two international presidents, to the stage. Sophia Zungas from Melbourne. Just for explanation, we had the last regional meeting, very successful meeting in Melbourne, and we will have the next one in April next year in New Delhi. So you have now to say goodbye to your baton, and you have to say hello.
It's been our great privilege to host the World Summit Regional Meeting in Melbourne this year, and it's our great honour to be handing on the baton to our colleagues at NIMS University in New Delhi. We're looking forward to seeing all of you in New Delhi next year. Thank you.
Congratulations.
Closer together.
Thank you all, and thank you, Axel. I'm grateful for hosting this event, WHS Regional Meeting in New Delhi in April 2005. You are all welcome. We are grateful to all of you, and thank you very much, Axel, Sophia, and Betty. And really, it's a grateful moment for me to taking this baton, this responsibility which Axel has given to us, and Sophia has transferred to us. Really, we will do the best. The best. Thank you very much. Great. All are invited. All are invited.
Thank you.
Thank you.
Thank you. So we are looking forward to that, to continue the very great development in the World Health Alliance. Okay, now I call for my boss, which is Heyo Krömer.
I was going to do that.
Ah, sorry.
I can't do anything. Okay, I'm on. Okay. You write a script, then they take all the speeches, right? Don't worry. So it's our great pleasure to welcome to the stage Professor Heyo Krömer, who is the CEO of the Charité. And it's my particular pleasure to be on the stage with you because you've been a patron and a supporter, and so has the institution, to the World Health Summit. And for the last 15 years, we've benefited in this collaboration to bring the World Health Summit to Berlin and be really strongly supported by the Charité. And even we have a Charité lounge this year. So I had the privilege of visiting that this afternoon with one of my guests. So thanks very much to Charité for the continued support, and over to you. Thank you.
Okay.
You can't take all this pictures.
Ladies and gentlemen, dear colleagues, if you give me a final 5 minutes of silence, I will finish this up. And as CEO of Charité, I'm really deeply honored to welcome you to the World Health Summit 24 in Berlin under this year's overarching theme, Building Trust for a Healthier Future. The World Health Summit was founded in 1929 by Detlef Ganten on the occasion of the 300th anniversary of Charité. And I'm delighted that this vital forum for global health has established itself and is now organized annually by the WHS Foundation. With the establishment of the Charité Center of Global Health and the close collaboration with the WHO Hub for Pandemic and Epidemic Intelligence, we have further intensified our efforts in the field of global health. And I would like to particularly thank Dr. Tedros for his continuous support of both WHS and the Berlin Global Health System. By uniting our efforts, sharing knowledge and leveraging our collective experience, we can address the most pressing health challenges in these times of multiple crises. This year's summit provides us with an excellent platform to jointly discuss highly relevant topics and challenges such as improving health of children and women, combating antibiotic resistance, and exploring digital health and the AI revolution. I would like in particular thank my colleagues, Professor Axel Pries and Carsten Schicker, for organizing this entire event. You can imagine how much work it is to set up a meeting like this. So great thanks to you both. And now I'm pleased to declare the WHS 2024 open. And this declaration is combined with the announcement that you should leave this room now, go to the next room.
Not now. We were ordered to take a photo. I will say that.
Okay. So he will finish that up. That was the wrong message. So the thing is opened, and have a nice evening. Thank you.
So we were ordered to tell you all that you have to cheer up, whatever your mood is. And we have to have the lights on, and the photographer takes a picture when you all do this. World Health Summit 2024. So, and now you leave the room without hesitation because it has to be renovated right now, and you go to your reception. Have a good
drinks
evening.
And music. Enjoy yourself. It's short and sharp.
Yeah.